here group 11. I'm Paudel and my partner Willis Marsh. Today we're going to talk about the video presentation, and our topic is randomized prospective study on the treatment of patellofemoral osteoarthritis using braces. And our outline, I'm going to talk about a little bit about the background, study design, methods, variables, and results, and critique of statistical analysis, strength and weakness, and conclusion. So, little bit background about the osteoarthritis. Osteoarthritis is the most common form of arthritis, which causes the loss of function of the joint. It is non-inflammatory disease of synovial joints. 52.5 million of adults older than 18 years old self-reported provided diagnosis of osteoarthritis. Study design, this is the randomized control trial, and our research question is, will the use of knee braces be effective for patients with osteoarthritis of the patella and femur? And patient population, 30 patients in each group. And inclusion criteria: symptomatic patellofemoral osteoarthritis of the knee, clinical treatment of the knee osteoarthritis for more than 6 months, and they take the patients with 30 years or older than that, because normally osteoarthritis causes the older population. Exclusion criteria: braces used differently from what was requested. Abandonment of the study: patients who could not read or understand the WMSC questionnaire form. And non-adaptation to the braces, skin and vascular complication of the braces. And statistical analysis, they use students' t-test and man-weekly test to describe the age and years of schooling, minimum, maximum, mean, median, and standard deviation. Fisher exact test was used to describe the gender. And there were control group 13.8% male, 86.2% female, and in the experiment group 21.4% male and 78.6% female, and the mean age was 64.2 plus minus 7.8, and mean years of schooling 8.1. And methods: independent variable, the type of knee braces, and neoprene knee brace with a patellar orifice, that's the control, and patella set neoprene knee brace with lateral reinforcement, and patellofemoral function brace, that's the experimental group. And Willis is going to talk about the development.
Okay, so for your dependent variables in the study, we had the effects of the braces on the patients with PFOA arthritis. One of the measurements was the WOMAC questionnaire for pain, stiffness, and function. These things, for pain there were 5 items, stiffness there were 2 items, and function there were 17 items. They were measured ordinally, with 0 equaling none, 1 equaling mild, 2 equaling moderate, 3 equaling severe, and 4 equaling the most extreme. The Lequesne index of severity was also used for osteoarthritis of the hip, which is abbreviated as LISOH. It was measured as 0 to 100, with 0 being the lowest and 100 being the highest in the test. There was also a 6-minute walk measured in meters, timed up and go, which was measured in seconds, and the 5-time sit-to-stand test, which was measured in repetitions, the number of repetitions each patient could do. This one is a result for the WOMAC pain score. As you can see in the figure, because the confidence intervals, each of them overlap each other, there wasn't a significant difference in the amount of pain between the two types of braces. The neoprene sleeve, the regular control group, as Sami said earlier, is denoted with the straight line, and the functional brace, which is our study variable, that's compared to the control group, is measured in the dotted line, and there was no significant difference. This one is a measure of the WOMAC stiffness domain. And as you can see here, for pre-evaluation, before the brace was added, there was a difference in the stiffness noticed between the patients. The stiffness was, the average for the functional group was about a little under 3.5, and the average for the control group was a little bit over 4.0, about maybe 4.2. After 1 month, there wasn't any significant difference as the confidence intervals overlap here. And after 3 months, there also wasn't really a statistically significant difference. For the function domain, each one of these was very similar. For pre and 1 month, there wasn't really a statistical difference between how the function differed between the braces. However, after 3 months, it almost was significantly different, but it still wasn't really a statistical difference, with the neoprene sleeve having a little bit higher of a score. Also, for the total WOMAC score, we see that the two braces actually had very similar results. The functional brace had slightly less on the WOMAC score, which meant that it was better. However, it wasn't statistically significant within the evaluation period from pre-treatment to 3 months. In the 6-minute walk time in meters, however, there was a significant difference for pre-evaluation. The control group had less meters walked, so they could walk only a little bit less than the functional brace group. As we see here, it's a lot higher. The average score for the functional brace over the 3-month period was about 440 here. For the Questney score, they were very similar. For pre and 1 month, they were about the same. It wasn't really statistical significant. But after 3 months, there also wasn't a statistical significance. However, the functional brace actually had less of a score. Had a score that was lower than the control. For the TUG, the time up and go, the functional brace had a lower score for pre-evaluation, as we see here with your confidence intervals. After 1 month, there wasn't a statistically significant difference, and after 3 months, the time up and go actually took less seconds to get up for the functional brace in the study. For the number of repetitions for the 5-time sit-to-stand test, the pre-evaluation for the neoprene sleeve, it was lower, but after 1 month and 3 months, there wasn't really a statistically significant difference in both sleeves. We're about the same. This is a table showing a lot of the comparisons between the two tests for mean difference in these scores. As we said before, the WOMAC score is right here. These 4 things: pain, stiffness, function, and total. And the Questney score is another one, and the 6-minute to walk time. For the WOMAC score, having a higher value means worse, and for the Questney, having a higher value actually means better. So for here, the statistically significant differences are marked in red. As you can review those. For lack of time, we're not going to go through each one of them, but I will explain just the first one, just so that you can interpret the pattern. So for the first one, for pain, we have pre-treatment as compared to 1 month treatment, and the mean difference between those two was 2.2. And this basically means that pre-treatment had an average of 2.2 higher than the 1 month treatment for pain, as compared to, well, yes, the pre-treatment had 2.2, had a mean of 2.2 higher than 1 month for the pain of the WOMAC score, which meant that it was not better. And it was statistically significant because the confidence intervals are both over 0. It does not intercept 0. And the p-value is under 0.05. And this is the same for each one of them. As we see, about half of these values are significant and half are not. And I'm going to bring up Sami to discuss the strengths.
Strength of the study. The study used the patients 30 years and older, and the study was the randomization, which limit the bias, and they mostly included the women. So women are more prone to cause osteoarthritis, so which was the strength of the study. And some of the weakness, they did not include the race of the patients, and which was not reflective for all population, and lack of measurement of improvement in patellar positioning and the patellar tilt to assess whether there is the real improvement on patellar alignment with the use of knee brace, especially during the movement, and not great system of randomization, and the study was unsupervised. And internal validity, although trial was randomized, there is the bias because the population was not reflective. So there is the low internal validity, and since there is low internal validity, the study was low external validity also, because the small size of the sample, race was not accounted for the result, where result were more subjective, and it was done only one hospital after a program was given to the participant of the study. So this is not reflective population. Now we're just gonna talk about the question.
In the study, both groups showed improvement during drug treatment, which shows the importance of non-surgical measures to improve osteoarthritis, including the knee braces as shown in the study. Suggestions to improve the study methodology. One would be, as we said before, was to increase the sample size. Another one would be to include race and ethnicity in the study so that we can see how it affects different populations in the US and in the world in general. Have a more effective way of reporting the studies. This will be more observational instead of just having the patients go along on their own, because like the patients may not have used the knee braces correctly. They may have also not have used it as frequently as they should have, et cetera, et cetera, et cetera. Also, they need to have a more systematic way of randomization in the study. Maybe using like a computer-generated system instead of just placing patients in random groups. Also, they can explain each test because we had to do a lot of outside research to find out what each test represented in the study, and they didn't really explain like the WOMAC score, the 6-minute walk time, the Questney score, the 5-time sit to stand ratio, and etc. For acknowledgements, we'd like to thank Dr. Wingate and Dr. Maneno for having us do this project. We learned a lot, and we are so grateful to be here presenting it to you at the Howard University College of Pharmacy. These are our references, as you can see, and we have a lot. Yay!
Thank you.
Thank you.